If you are over 60 and you take more than 2 medications every single day, I need you to stay with me for the next few minutes. Not because your medications are secretly evil, not because your doctor is lying to you, but because there is a conversation almost nobody is having about how medications behave differently inside a body over 60. And that gap in knowledge is costing people the quality of their lives, sometimes the lives themselves. My name is Don Neighbors, and I spent 20 years working directly with elderly patients. What I'm going to share with you today is what I wish every person over 60 already knew. I want to tell you about my patient. I'll call her Dorothy. She was 68, sharp, grew her own vegetables, called her grandchildren every Sunday without fail. She came to see me not because she was sick, but because she was exhausted. She looked at me and said, "Doctor, I do everything right. I take every pill. I go to every appointment. So why do I feel like I'm slowly disappearing?" When I sat down with her full medication list, she had 9 prescriptions from 4 different specialists. Not one of those 4 doctors had ever reviewed all 9 medications together, and 3 of them were creating a chain reaction inside her body that explained everything she was feeling. This is not a horror story. This is a story about a healthcare system that was never designed to see you as a complete person. And today, I want to help you see yourself that way. Before we go any further, drop a number in the comments right now. How many medications are you taking every day? Just a number. I read every comment personally, and your answer helps me create content that actually speaks to your real life. The 5 medications. Number 1, statins. Cholesterol medications like atorvastatin and simvastatin. For many people, particularly after a heart attack, these genuinely save lives. But here is what often goes unmentioned. Your body uses the same metabolic pathway to produce both cholesterol and a molecule called CoQ10, essentially fuel for your heart muscle. Statins reduce CoQ10. This is not a secret theory. It is documented in medical literature. After 60, your CoQ10 levels are already naturally lower. The question worth bringing to your doctor is simply, should I be supplementing CoQ10? Not stopping your statin. That one question. Number 2, NSAIDs. Ibuprofen, naproxen, diclofenac. I understand. When your knees hurt or your back seizes up, these feel like the only option. And short-term, occasionally, they are reasonable. But after 60, your kidneys are working harder than they were at 40. Your stomach lining is thinner. Long-term daily NSAID use genuinely raises the risk of kidney stress and cardiovascular strain, especially combined with blood pressure medication. Ask your doctor, is there a safer, long-term way to manage my pain? There very often is. Number 3, proton pump inhibitors, omeprazole, pantoprazole. These were designed for 8 to 12 weeks of use, but millions of seniors have been on them for years, sometimes because nobody ever looked back and asked whether they still needed them. The real concern is that stomach acid helps your body absorb magnesium, vitamin B12, calcium, and vitamin D. Long-term reduction of that acid can quietly create deficiencies that affect your heart rhythm, your bones, and your energy. Ask your doctor, do I still need this? Can we try stepping down? Number 4, beta blockers, metoprolol, atenolol. Genuinely important for certain heart conditions, but also one of the most over-continued medications in older adults. Started for one reason and kept going long after that reason has changed. If you are on a beta blocker and you have been feeling unusually tired, cold, or low in mood, those can be real side effects in some people. Worth knowing, worth asking, is my dose still appropriate for where I am today? Number 5, blood thinners, warfarin, rivaroxaban, apixaban. For people with atrial fibrillation, these can be life-saving, but they require more active monitoring as you age because your fall risk changes, your bleeding time changes, and they interact with common medications. including aspirin and ibuprofen. If you take a blood thinner, make sure every healthcare provider you see knows before any procedure. And if you have had even a minor fall recently, bring that up with your prescribing doctor before your next scheduled appointment. If you are watching this and thinking about a parent, a spouse, or a friend who takes a lot of medications and always seems tired or off, please share this video with them. Not to alarm them, but because the most powerful thing any person over 60 can walk into an appointment with is one good, specific question. That is all we are doing here, building better questions. Dorothy came back to see me 3 months after that first visit. We hadn't stopped any of her medications, but we had sat down with her primary care doctor and reviewed every single one together. 2 doses were adjusted. One medication was discontinued entirely because it had been started years earlier for a condition that had since fully resolved, and nobody had ever looked back. She sat down in my office and said, "I feel like myself again. That is what I want for you. Not fear, not distrust of the people trying to help you, but the kind of active, informed partnership with your healthcare team that actually serves your whole life. You are not too old to ask questions. You are not being difficult when you want to understand what you are putting into your body. You are being exactly what every good doctor hopes their patient will be. Write these 5 questions down and take them to your next appointment. 1. Do I still need this medication, or was it started for a condition that has since changed? 2. Is my current dose right for my age and for my current kidney and liver function? 3. Are any of my medications interacting with each other? 4. Should I be monitoring any nutrient levels, magnesium, B12, vitamin D? 5. What symptoms should I watch for that would mean we need to reassess this? If this was useful, comment below and tell me which of the 5 medications you want me to do a full, deep dive video on. Whichever gets the most requests is the next video I make. Subscribe if you want honest, practical health information made for people over 60. No scare tactics, no supplements to sell you. Just the things I genuinely wish more people already knew. And please, share this with someone who takes a lot of medications and deserves to feel like themselves again. It costs you nothing. It might mean everything to them. Take care of yourself. See you in the next one.